Respiratory syncytial virus, or RSV, is a common and potentially serious infection that affects the lungs and airways. It can cause mild symptoms like a cold in healthy adults, but it can also lead to severe complications like pneumonia and bronchiolitis in older adults, young children, and people with weakened immune systems. Every year, RSV causes about 60,000 hospitalizations and 6,000 to 10,000 deaths among adults aged 65 and older in the United States. Fortunately, there are now 2 vaccines that can help prevent RSV disease in older adults: GSK's RSV and Pfizer's RSV. These are the first RSV vaccines approved by the FDA for this age group. They are both given as a single shot in the arm before the winter RSV season. How do these vaccines work and what are their benefits and potential side effects? Let's find out. Both RSV and RSV contain a protein called prefusion F that is found on the surface of RSV. This protein helps the virus enter human cells and cause infection. By exposing the immune system to this protein, the vaccines stimulate the production of antibodies that can recognize and neutralize RSV if it enters the body. RSV also contains an adjuvant called AS01E, which is a substance that boosts the immune response to the vaccine. RSV does not contain an adjuvant. Both vaccines have shown to be effective in reducing the risk of lower respiratory tract disease caused by RSV in older adults. According to clinical trials involving tens of thousands of participants, RSV reduced this risk by 83% and RSV reduced it by 67%. Both vaccines also reduced the risk of severe RSV disease by more than 80%. The most common side effects of both vaccines were pain, redness, and swelling at the injection site. Some people also experienced headache, fatigue, muscle pain, or fever. These side effects were usually mild or moderate and lasted for a few days. However, there were also some rare but serious side effects reported in some vaccine recipients. These included autoimmune syndromes such as Guillain-Barré syndrome and Miller-Fisher syndrome, which affect the nervous system and can cause weakness, numbness, or paralysis. These cases occurred within a week or 2 after vaccination and were more frequent with RSV than with RSV. The exact cause of these side effects is not known and further investigation is needed. The CDC's Advisory Committee on Immunization Practices has recommended both vaccines for adults aged 65 and older. However, they have also advised that people who have a history of Guillain-Barré syndrome or Miller-Fisher syndrome should not receive RSV unless the potential benefits outweigh the potential risks. The CDC will also monitor the safety and effectiveness of both vaccines as they are used in real-world settings. They will also determine how often people need to be vaccinated against RSV and whether one vaccine is preferred over the other. RSV vaccines are an important breakthrough in preventing a common and potentially deadly infection in older adults. By getting vaccinated before the winter RSV season, you can protect yourself and your loved ones from this virus.